As I got older and heavier, I began having pain in my knees. I was bow-legged from birth and working 12-hour shifts. As the pain increased, I just bowed my legs out more because that seemed to ease the pain. Actually, what it was doing was causing problems for my back, my hips, and my ankles. Eventually, I sought care. I tried physical therapy, strongly recommend it. I had the steroid and the gel injections in my knees. Those helped for a while. I was looking for any alternative to knee replacement. I'm familiar with the various things they can do with a catheter in the heart, and it was just astounding to me that there was no alternative to knee replacement, but I was told there was none. Fortunately for me, this past Thanksgiving, I happened to be looking online again for alternative knee replacements and found genicular artery embolization and found that it was done locally by Dr. Al-Masri at Lakeland Vascular Institute. So I went to my primary care and he said, "You want what?" "We'll have to ask ortho." I went to ortho and they said, "You want what?" Well, I was there for a series of 3 knee injections, and my 3rd knee injection got delayed, so I had a different provider, and that provider said, "I think I heard about this at a conference I went to. They had a booth set up, but I didn't go in." I said, "Would you please give me a consult and let me explore this?" She did, and I was seen by Dr. Al-Masri. I was evaluated, found to be appropriate for the procedure. One of the driving forces for me in trying to do something, even concede and get knee replacement surgery, was my knees would often be stiff. And if I had a normal stumble or a little trip, instead of being able to bend my knee and catch myself the way I anticipated I would, the knees wouldn't bend. And I don't know if you can see it, but my left ankle, I have a foot fracture because I fell before I could get the procedure with Dr. Al-Masri. Since then, my knees bend. Okay, it's a wonderful thing to have knees that bend, especially when you step off of a curb or have any of these little everyday life adventures where, you need to react and your knee actually needs to bend when you want it to. The second thing was the pain. At night, I would have different aches and pains, but I would have felt like a burning wire going straight across here between the end of the thigh and the top of the lower leg. That's gone completely. Obviously, this boot and the other shoe isn't quite as high, so I'm walking like this right now while my foot heals. So obviously I have aches and pains in that from my back and the muscles in my legs and things. But the inside, the knee pain, that is gone. The swelling, the bending, that is the way it should be. Don't hesitate. The other thing I would recommend is, as in my case, I was bowing my legs out further and further. I would encourage a recommendation for a physical therapy evaluation to be given to patients who have this, because if you have this problem, you probably have one of the problems that go with it. And I've had physical therapy before and it really helped. I can't have it right now till I get rid of this foot fracture, but I'm looking forward to having it again and getting mobile, getting my life back to letting me do what I want to do.